Hello, my name is Sharrie Harlan, program host for Reid Beside You, and today our guest is Dr. Amber Wolsiefer, and one of our audiologists from Reid Health. And welcome, Dr. Wolsiefer.
Thank you so much.
And this is your second time on this show.
It is.
And I see that you've been board certified in pediatric audiology.
Correct.
And what does that mean?
So audiology is a very general field as a whole, and there are different tenets or facets of audiology that you can become more acquainted with, we'll say. Pediatrics is a passion of mine, so I went on to become board certified specifically in pediatric testing. So it just means that I deal with diagnostic testing and treatment of hearing loss and balance disorders exclusively on kids.
Oh, great. Now, how many pediatric audiologists are there?
Not very many. So there's about 80 in the United States, and as far as I know, I'm the only one in the state of Indiana.
So that is a great plus for our service area.
It is. It is.
And now, how many children have hearing loss?
Childhood hearing loss is pretty common. There's about 5 out of every 1,000 children that will be diagnosed with hearing loss somewhere between the ages of, let's say, 3 and 17. And an additional 1 out of every 1,000 children are born with hearing loss, what we call congenital hearing loss.
Okay, because we normally, if we associate hearing loss with older
adults,
normally.
Most people do, yes.
And with that, so how do what causes hearing loss in children?
There are a lot of causes. The most common cause of childhood onset hearing loss is genetics. So obviously you can be born with any myriad of genetic factors. Other things that can cause hearing loss can be illnesses like meningitis, or untreated middle ear infections can cause permanent hearing loss. Noise is a factor, so environmental factors, racing, hunting, those type of things. But in children...
So is that why lately if you see racing events and there's children or concerts, you see
hearing protection.
They have the hearing protection.
For sure. And in kids, common causes are noisy toys. So what we don't think about with infants are that the toys that we're buying our infants that we're holding in our lap and going, oh, that's cute and it makes a fun sound, kids have at the level of their face, very near to their ears. So it's much louder to them. And then of course in teenagers we have earbuds and music, and all of that can be detrimental if dangerous levels or too long.
And loud music is,
For sure.
Is a problem as
it's
well.
A big one.
Correct. And so one of the things, what happens if the adults can hear the music? Often you're somewhere, if you're walking and you can hear another person's music.
Yeah, a good rule of thumb to follow is that if somebody else can hear it, it's too loud.
Okay.
Yeah.
And is there a way to prevent hearing loss?
There is. The obvious would be avoiding, so don't go to those events. Or you can wear hearing protection. In children, the most common form are ear muffs that you can buy that just fit over the top of your ears. You can get custom hearing protection. We take little impressions of the molds and send them off and have custom hearing protection made. They work great. You just have to replace them often because children grow so quickly.
Right.
So
what are some of the signs of childhood hearing loss?
So a lot of the signs come from recognition from the parents, where they'll say they don't seem to understand me or they don't respond to me. Big sign is if a child doesn't startle to sounds. If you drop a pot in the kitchen and your child doesn't even notice it, that can be a sign of hearing loss. In school-age children, we see this with what we think are behavioral problems. Teachers will say they don't listen, they're not following directions, they won't sit still. Kids who can't read or spell very well often are found to have hearing loss. And it all kind of makes sense. If you can't hear the instructions, they're really hard to follow.
Correct.
You know, that kind of thing. So things we don't think about, though, I think.
Or what about the infant, if they feel
Yeah, so all infants in all 50 states now have a newborn hearing screening at or shortly thereafter birth. So if those infants don't pass that hearing screening, then they get referred on to myself or colleagues in the area that
And some of those other challenges would include speech delays?
Sure, speech delay, language delay. Some kids with hearing loss have trouble walking or with their balance because our ears are also responsible for our balance mechanisms. So there can be disorders that tie those two together.
Okay. And also, what are some of the other signs? seeing that children with hearing loss often are shy and isolated?
Yeah, I think a big one is just depression and social isolation. Kids tend to just kind of be a hermit. You know, if I can't hear and be involved with my group of friends, I get made fun of. So if I'm going to get made fun of, I think I'd rather just stay over here by myself. And a lot of times that goes pretty far before we're able to kind of catch on to
So that involves like low self-esteem?
Absolutely. All kinds of...
And like you said, once again, the behavior problems that you would...
They all just kind of tie together there.
And also they seem to be more tired?
Absolutely. So fatigue, headache, just like when we have vision problems, we have eye strain. When you have a hearing loss, you strain to hear, and that can cause all kinds of physical issues. Just because throughout the day listening, that's a difficult thing to do. For you and I, when we start to lose our hearing, we recognize that as different. But a child that's had hearing loss from either birth or a young age, that's all they've ever known. So they just appear to be tired all the time. You know, they don't know any different until we correct that.
And that's unique. And how do you test children with hearing loss?
So older children are tested very much like adults. We put them in the booth, we play a series of tones, they raise their hand when they hear the beep. Babies and young children, we test while they're asleep. We put a series of electrodes on the forehead and behind each ear, and they listen to a sound, and we're able to measure the response up the auditory nerve. It's actually quite fascinating.
And so, and is there a process that you prepare the parents?
We do. So you can do this type of testing several ways. Here at Reid, we do all natural sleep deprivation. So there's no sedation that goes into this. We're asking families to keep their children up later that night and get them up earlier the next day. The worst part is on the parents because they don't get any sleep that night. The next day, I imagine, it's pretty crummy too. But yes, we just have them deprive their children of their natural sleep, and then when they come to the office, it's a nice quiet room. There's a recliner, a crib. There's all kinds of accommodations that can be made to help get them to sleep. And then we proceed with the testing.
And so back on the older children in the sound booth. And the techniques to use games, or how do you do that?
Yep, so there's kind of a bracket between infants that need to sleep and children that can raise their hand, on those kids that can't understand that task. So we condition them to play a game. So for example, they get to hold a peg to their ear and listen for a beep, and when the peg beeps, which sometimes they actually think the peg is beeping, but you know, when they hear the beep, they get to put that peg in the pegboard and make a design. So by the end of the test, they have a nice little pattern of whatever they've made, or you can do it with anything. You can throw Q-tips in a trash can.
Or one of the things I've seen was Mr. Potato Head.
Yes, absolutely. And listen to his eyes and put them on when you hear the beep. And anything you can think of, you can use for this type of testing.
And so in dealing with the children, you seem to be a lot more have to be a little more creative.
I think it's more fun, to be honest. It's playtime every time I get to see a kid. Some of them buy into that, and some of them, of course, it doesn't work.
That's
not
their
so much for them.
And how long is an average test?
Sometimes 20 minutes, sometimes an hour. It depends how long the child is willing to give us.
Okay.
We like for it to be closer to an hour, but I'd say average is 30 minutes.
And what's some of the, with the parents, what's some of the success? Have you had, I'm sure they're excited.
We get a range of emotions. So I've actually had parents be excited that their child has normal hearing, and then I've had parents be excited that their child has hearing loss because they finally have an answer for why they may not be doing well in school or why they may not have speech and language that's appropriate to their peers. On the flip side of that, I have had patients that are equally upset when their child has normal hearing because we don't have an answer. So you get a range of emotions. Most people are, it takes them a while to process. So we might give counseling at that session, and then we might have them come back in a couple weeks so that we can talk more about what's going on with their child and how we can help them.
And when you're saying counseling, are you counseling both the child as well as the parent?
Yes, for sure. Mostly the parents, but I think personally I put a lot of responsibility on the children that I see at understanding their own hearing loss, because they're the ones that are going to have to advocate for themselves in the school system. And as they age, as they go to high school and college, mom's not going to be with them every single step of the day. So it's just as important for the child to understand as it is the parent.
Okay. And so what happens if the hearing loss is confirmed?
If hearing loss is confirmed, we schedule an appointment to talk about rehabilitation. So how are we going to deal with this? Depending on the type of hearing loss, the degree of hearing loss, we could do hearing aids. We could do assistive listening devices in school. So like the teacher wears a microphone and the child wears an ear level device so they can hear their teacher through all of the classroom noise that's in front of them. We can refer on for cochlear implants, which is an internal device that can help children or adults hear better. There's bone-anchored hearing aids for people who have problems in their middle ear.
On the cochlear, that's probably what people have seen the most, probably just through social media and other things where you see the baby who couldn't hear.
Absolutely,
And
those
then-
videos that you get to
right.
see when they turn them on and they're hearing for the first time. And we get that with hearing aids, not as much. Cochlear implants, it's a bigger difference because they go from hearing nothing without them to hearing something for the first time with them.
Okay. And the so there's different types of amplification. And so that's depending on...
Depends on what the cause of the hearing loss is. So we
Okay.
can have nerve damage, we can have fluid in our ears, or a problem with the bones in our ears. There's all kinds of medical issues that you can have with the ears where a traditional behind the ear hearing aid or in the ear hearing aid isn't the right answer. You might need a hearing aid that sends the signal through the bone in your skull. It's called a bone conduction hearing aid. They're not as common as traditional hearing aids, but they're perfect for the right patient.
Okay. And there are other assisted living listening devices?
Yeah, there's all kinds of things. There's amplified smoke alarms. There's low frequency smoke alarms. So for people that can't hear high pitches, there's low instead of a high pitch beep, it's a low beep. There are phones that are amplified or that work through hearing aids now. Alarm clocks, there's bed shaker alarm clocks. So there's all kinds of devices on the market that some are used with hearing aids, some are used without. But anybody with hearing loss can benefit from these type of devices.
Okay. And how does someone schedule their child to see you if they'd
So
like?
audiology scheduling sometimes requires a referral, sometimes it does not. So the best way to do it is to just call the office. The number is 765-935-4477 and talk to the receptionist, tell them what your needs are, and they will guide you through whether or not you need a referral or to contact your primary care or whether you can just come straight to see us.
Okay. Well, thank you so much
You're
for
welcome.
visiting with us today.
Thank you.
And you will have information that you can reach Dr. Wolsiefer once again on the screen. And thank you very much for joining us.
Thanks, Sharrie.
Hi, what seems to be bothering you?
Hey Doc, I got a fever and chills. I really don't think I should be on the road.
Okay, I think that's something we can help you with.
Real-time care anywhere. Reid Health Now, right beside you.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health Now, right beside you.
Welcome back to Reid Beside You. And our next guest is Rachele Severance from the Reid Family Birthing Center. And she's here to speak about Safe Baby Initiative. And Rachele, could you tell us about what the Safe Baby Initiative is?
Well, the Safe Baby Initiative for the Family Birthing Center is just to educate our parents, to give them tools that they need when they go home about safe sleep practices, their car seats, what's appropriate for their baby, and a safe sleep environment. So we want to give them those educational pieces while also making sure that they go home with those. So if they don't have a car seat or if they don't have a crib, we provide those for them.
Okay, and we're going to step back a minute and we're going to go over each one of those.
Okay.
Those initiatives. So tell us about the Safe Sleep Initiative or the certification.
So we were certified about a year ago. So what we do, we have safe sleep sacks like this one here that we give to our babies at discharge. While they're in the hospital, we place those in the sleep sack. For one, it keeps them wrapped up, they feel warm, comfortable, and it's a good thing to put them in while they're newborn. They like that tight environment.
And a lot of people, maybe people my age, are familiar with the safe sleep sack or the swaddle. And so, what are the positives about being in the swaddle or
Well,
the sleep sack?
one, it's easy to put on the baby, but it keeps them feeling like they're kind of in the womb, and it's easy to open, change their diaper, and then when they're placed in the crib, they're warm, so they don't have to have extra blankets. Parents are always worried about keeping their babies warm, but in the sleep sack they will stay warm and they don't need those extra blankets that parents like to. Those fluffy blankets that parents like to put in the crib because they want them to be more comfortable are really actually dangerous for babies because they could be smothered by those. So that's why we discourage adding any more blankets to the babies because these sleep sacks keep them warm.
Okay, and another thing is, which I was shocked on, removing the bumpers
Yeah.
and the baby bed.
Yeah. So no bumpers, no pillows, no stuffed animals, anything that the baby can roll over and smother themselves. You want to take out of the crib. So the baby should be laying on a flat surface with just a sheet, and then the sleep sack, and that's all that should be in the crib.
And part of this whole initiative was, I know Indiana has a very high infant mortality rate.
Yes. So our infant mortality rate for Indiana, I think it's 7%. In the U.S., it's 5.9. So I know, this Safe Sleep initiative, we're hoping that we'll be able to decrease that rate and get within the U.S. rate or lower. I mean, our goal
Correct.
is to have zero because,
Right.
we don't want to have these families be one of those statistics. We
And
want them.
that's why we were happy that you were on here, so we can let our viewers know, because so many times people would say, well, this is how we've always done this, and realizing that was it's a hindrance for
Yeah.
safe sleep.
Well, and I think, it's kind of like parents will say or grandparents will say, well, we did this with you and you're just fine. But we know through research that, sleeping on their stomach, sleeping with your baby, those things increase your risk for your baby to have SIDS. And, knowledge is power. So if we know that these things can cause that, then, we should be really diligent in letting our parents know that, no, sleeping with your baby is not good, sleeping on their stomach is not good, and just all these other risk factors.
And some of the other factors that contribute include obesity, and how's that include?
Well, obesity, smoking, there are a whole kind of plethora of things that increase their SIDS risk. Sometimes there's really not a clear-cut answer for babies that are there with parents that smoke, but they all are risk factors that they found in common when they're, because sometimes a lot of this is unexplained, but they do come from homes that, that parents are smokers, or if they're obese, they may be sleeping with the baby and they just may roll over on the baby, and not to say that that's the only reason that but the baby should be in their own environment in a crib.
So on that note, we're talking about some of the safe sleep practices.
Yeah. So when they're, when you feed your baby, when they're sleepy, put them down in the crib on their back. You should never, when you're feeling tired, as new parents, moms and dads are sleep deprived. So as soon as, they're having those nighttime feedings, as soon as they're finished, change the diaper and put the baby back in the crib or the bassinet immediately after because, you can easily just fall asleep with them in your arms and, you could drop them. Things like that. So you just want to get them back.
I mean, one of the biggest things is not to sleep with the baby, correct?
Oh, yeah. Just because, parents are sleep deprived anyway, we've had several inpatient, babies that fall because parents, are feeding them and they just fall asleep and then they drop the baby because their muscles relax and then there's the baby on the floor. And, we know parents, they definitely don't want that happening. But if we can educate, that it's important that, that they're getting those babies back in their beds as soon as possible, that will help, prevent that.
And now we have a car seat. We have our
Yeah.
something here to show you.
Yeah.
And probably one of the things that I was most surprised about is that car seats have an expiration date.
Yes. So
Can you tell us about that?
Yeah. So usually, like on the side or the back of the car seat, they will list a manufacturer date. So most of the car seats list the manufacturer date, and then it's 6 years from that date is when the car seat expires. So, really I discourage people from getting car seats from friends,
Garage sales?
online, garage sales, because you don't know if that car seat's been in an accident. If it's been in an accident, then that needs to be disposed of. So, you want to make sure that, your car seat is up to date and not expired.
Another thing is, if you've been in a wreck, then your car seat is really not
It's
compliant.
No, you should dispose of it then. You should not allow anyone else to use that after it's been involved.
And what happens if I'm at the hospital and I had no income to get a car seat? Is there a referral program or
Yeah, so,
other people that can help?
oh yeah, so when you come in, we ask those questions, do you have a safe sleep environment? Do you have a crib? Do you have a car seat? A car seat is one thing that we will provide. Our car seat specialist, if you will, Melanie Tucker, she fits the babies with the car seat, and then she installs them with the parents as well. So there's no baby that goes home without a car seat. So
does she actually go to the car with them?
Yes,
and explains what's the best way?
Yes. So
do that.
yep. So we provide, and if we have a family that they have a young child that's still in the infant car seat, but they need to move that baby out so the
Okay.
next baby can come, we also provide toddler seats as well.
Okay.
So all they need to do is just call our unit, and then we can set up an appointment with Melanie, and she can provide that for them.
And so that's normally when they're becoming inpatient, is that handled
Yeah,
there?
and also we do have flyers out to like the family practice areas of Reid that have that information where they can contact us. So they don't have to be inpatient
Okay.
to get a car seat. So if they had an infant car seat and they're like, well, we're going to need a toddler seat, they can contact us and we can get her one. So they don't have to have a baby at Reid. They just need to have a need for it, and we will get them one.
Okay. And the other thing is cribs for kids.
Yes.
And how's that program work?
Melanie was able to get a grant for several cribs this year, so we really want to finish out the year with a bang and give those cribs to anybody that
And was
needs
that
them.
a grant from the Reid Foundation?
Yes.
Okay.
So as many people that need them as many as we're going to give out. So if there's a need for it when they come in, we will provide that. Provide them a crib. They do have to do some education with Melanie about that, and we do some follow up just to make sure that they're putting them in a safe sleep environment. So
Another thing is I know that you, the Family Birthing Center works with, you have monthly meetings with other groups. Could you tell us about those meetings?
I think probably the one that kind of comes to mind is Birth to Five. Vicki is very
Grammy?
involved. Yes,
Okay.
yes, really love her. She's very involved with the Birth to Five. So we do a questionnaire when they come in with the parents. They can do like parents as teachers. They just give them opportunities for their kids to be involved with different things. There's play groups they can do. So there's different things that Birth to Five. It's not just one area. There's many things that they can do that is involved in education with their kids and knowing that they're doing well. So I Birth to Five for me is a big
Partner? Great
partner.
partner.
Yes, and Vicki's just very easy to talk to and works with lots and lots of families in Wayne County.
The other thing is, if as we look at what's sudden SIDS for sudden infant deaths, and this it actually involves pretty much everything we've spoke about today. So we look at with the SIDS and then accidental suffocation, strangulation. In cases like that, often you hear, do we work with other groups? And I know that you have monthly meetings with the DCS, Department of Children's Services, and the psych ward. So all those things are taken into consideration with the entire Family Birthing Center and for our safe baby initiative. So, well, we want to thank you. And another thing is, as we end, I want to make sure we have the contact information. People can call the Family Birthing Center. Do they
Yes.
ask for you? Do they ask from Melanie? Or?
I mean, they can certainly ask for me, but Melanie is that person that will be in contact with them. So if they want to call our number at 765-983-3020,
Okay.
and they can ask for Melanie, and she can set up an appointment, but by all means, they can ask for me because I know how to get in contact with
Great.
her.
Well, we want to thank you, Rochelle, for joining us today.
you.
And as we learn more about the Reid Family Birthing Center.
Thank you.
And thank you.